This is the Community Pharmacy Roundtable. We host these occasionally to help our community pharmacies know about what the latest and greatest services as well as products are coming out. We have some great partners in this roundtable, but everything we do is to help our pharmacy partners be successful and generate more revenue or get more reimbursement from the insurance side. We have some amazing things to talk about for non-insurance payment to community pharmacies today as well. So my name is Breck Rice. I'm one of the co-founders of ServeRx. I've been helping community pharmacies for over 20 years, started back in 2003 with a little third-party company out of Memphis, Tennessee, with a nice generic name called Third Party Solutions. So Third Party Solutions, or TPS, was the PCN in almost everyone's pharmacy system at one time, because every pharmacy in the country used it. It was a wonderful program. And it was such a wonderful program that everybody used it, and a big PBM saw the opportunity to direct all those claims into their networks and make millions and millions of dollars. And so unfortunately, the company was acquired by a big PBM. We won't mention any names, but their initials are OptumRx. And I didn't want to go to work for the devil, so I left, and a couple of years later was able to help start ServeRx program, which is the same TPS benefits, all the wonderful things that TPS brought to community pharmacy, but with 20-year newer technology to use. And so the ServeRx program is the new and improved TPS, and we'll hear a little more about that in just a minute. When I started back 20 years ago, profit margins were a lot different. I think you can all attest to that. If you are running a pharmacy, you know that margins were a little different back in the day. And a lot of you are familiar with this report from Fortune magazine that talked about, how many independents have actually closed their doors now. And most of that is due to the profit margin going from slipping from 36% down to 3 to 5%. So it's pretty hard to stay in business with those margins, because quite often those are below even your acquisition cost of the medication. So what can we do about that? And that's where we come in with the roundtables and with the services that we provide at ServeRx to try to help our community pharmacies offset some of those horrible profit margins. And so first, we want to just give you the overview real quick of our program and how it works. And Will, would love to have you explain that to us, if you would.
Absolutely. Good morning, everyone. This is how ServeRx can help the pharmacy receive those fair reimbursements that you legally deserve under workman's comp.
Can everyone hear Will? Is it pretty hard? Might need to get a
Hello?
little closer to your microphone there, Will. Sorry.
Yeah, it's
Hello,
hard
can
to hear.
everybody hear me a little better now?
Yeah, you're cutting in and out.
Sorry, difficulties. Is that better? No?
A little better.
Yeah, so how ServeRx we can help with the fair reimbursement that the pharmacy legally deserve is, as you can see right here with this chart. Say a Temesis or any PBM comes into your pharmacy with a workman's comp claim, a patient with like some meloxicam. If you was to process that PBM through your vetting PCN for meloxicam, your pharmacy will be reimbursed, you see right here, $4 to $5. Can everybody hear me?
Yep.
You hear me?
Yeah, if you can turn off your camera, because it sounds like you don't have a lot of bandwidth.
Okay.
Yeah, it's just a little choppy.
How about now? Is that a little better?
A little bit.
So if you process, so for example, if a patient comes into the pharmacy, they have a PBM card, and you process a meloxicam through a PBM, your pharmacy may be reimbursed $3 to $4 for that medicine. Now that same medication, if you were to adjudicate through ServeRx's bid in PCN, your pharmacy will be reimbursed anywhere from $91 to $101. Okay, and that's how we help receive those fair reimbursements. We reimburse the pharmacy for brand medications, 85% plus a $2 dispense fee of AWP. And for generic medications, we reimburse the pharmacy of AWP 70% plus a $2 dispense fee. This is a free service. There's no enrollment fees, no annual fees, no monthly fees. Your pharmacy will be paid in 30 days through your central pay if you are with a PSAO. If you are not with a PSAO, ServerX will pay the pharmacy directly for those claims in 45 days. We do have a help desk that's available 7 days a week. If the pharmacy receives a rejection for a claim, you feel free to give our help desk a call. Sorry if everybody couldn't hear me and I'm breaking up.
Yeah, no worries. So yes, appreciate that, Will. And you know, real quick, just to recap, it's straightforward. Most of our pharmacy partners are already contracted through their PSAO. If somebody does have a, you know, if somebody does have does their own contracting, then we can certainly do an independent agreement as well. But most contracts through your PSAOs already cover our program because we are their preferred processor. Now, we do realize that some PBMs do hold you hostage. They make you process through their program. So if it's, you know, Catamaran, Cypress Care, anything with, you know, United Healthcare, they force you to use Optum, and we know that. But the good thing about our program, and it's like I said, they kind of hold you hostage. So if you want United Healthcare patients, the 65 million lives that they cover, then you kind of have to take all or nothing with them. But one of the wonderful things about workers' compensation is that still about a third of all the claims are self-insured. So these are self-insured employers who are paying the bill. They're not going through Optum or Express Scripts or CVS Health Caremark. So those are the ones that we can really help our pharmacies get that more fair reimbursement on. And it's usually 3 or 4x of what the PBMs would pay you for the same medication. Like Will said, that if you're not enrolled, get enrolled because it doesn't cost you anything. And if you can process to us, then great. Some of the other third-party billing programs that you should be aware of is if you're in a state that has a good auto program. Most of the auto processors have also been gobbled up by the big PBMs and rolled into their networks, but there's still one independent out there like us. That's the other point that we should really make here about the third-party processing with ServRx is we are completely independent. We don't have any affiliation with a PBM or even a mail order fulfillment. So even if you get an okay reimbursement from from a PBM on work comp, 50% of work comp claims have 8 to 10, 12 months of refills. So when the PBM sees that, they immediately send a letter out to the patient and make it look like it's mandatory for them to take their refills through the mail order. So now they're even bypassing your pharmacy completely and just having the patient go through their mail order fulfillment. So that's something we would never do to you. And Bridgeport is another third party for auto that does the same thing that we do just for auto claims, and they're also independent, no affiliation with PBMs or mail order fulfillment. The other thing too that you can consider is every one of your municipalities or right in your own community, there are self-insured employer groups there. Each state has an association. So here in Arizona, it's ASIA, the Arizona Self-Insured Association. Your state has an association. You could find out if any of those association members are neighbors of yours, and you can go direct to them and offer them a program to be their pharmacy of choice. Why not keep those revenue dollars local? Because if they're using, a PBM out of state, the revenue dollars aren't staying there, and the claims aren't staying there usually. So It's a really wonderful program. We can help with the RFPs, the request for proposals, because our software does the exact same thing any PBM software does. We can set up formularies. We can adhere to the ODG guidelines, everything that a PBM can do, only it's going to be a much better reimbursement for the pharmacy and still save the employer groups about 30% is what they end up saving on their pharmacy program. Basically, we take the $100 per claim that Optum and Express puts in their own pocket every time they process a work comp. Yeah, that's about right. They pay you $4, they pocket $100. So we take that $100, we throw it back into the pot and split it between the payer and the pharmacy, so you both win. So that's a really good opportunity if you have those relationships or want to go out and build those relationships with employer groups. All your cities and municipalities are self-insured, so we're happy to help with that. Next thing we want to talk about is wellness centers. If you have space in your pharmacy, you should consider bringing in clinical services, doing more things that patients can go to, a one-stop shop. They can go right to your pharmacy, have a doctor's visit. In fact, a study here by Will says that virtual primary care will surpass in-person visits, and we're pretty close right now. We're probably about 50% of visits are virtual and 50% are primary care. But due to the pandemic and COVID, telehealth has become more acceptable by patients, and so now they're more used to visiting with a doctor over a computer screen or a tablet now. The cost to the patient and also to the healthcare provider is significant. It's usually about 40 to even 50% less. And there's some amazing programs that we can introduce you to get that set up so that you can be your own wellness center. One of the telehealth programs that we partner with really focuses on diagnostics. So they're helping you set up, if you don't already have vaccinations and testing in place, they can help with that. And then brand new, this is absolutely, you're the first to hear about this, is we have an amazing program, My Home Health, that we're partnering with. This is for any sexually transmitted diseases. So this is totally confidential. Your pharmacy will get a QR code that you could even just hang a poster up, and so the patient can just kind of casually, slyly take a picture or put their phone up to the QR code and get the link. And then if you can carry the test kits. There's a male version and a female version of these at-home kits. You can carry them at the pharmacy, but for complete confidentiality, they can just scan the code and the lab will send it directly to them in a unmarked packaging, similar to the advertisements you see for Hims or any of the erectile dysfunction medication type things that are sent for home. So simple program to set up. Patient scans the QR code, and then a kit is sent out to them. Each pharmacy has their own unique QR code, and so then you're getting somewhere it's like $12 to $20 per kit that goes out for those home tests. Then if the patient's tests come back positive, then there's a whole process to get them a discrete telehealth visit to then be prescribed what medications are needed. And if some of those medications are pretty expensive, so if it's not something that you want to carry at your pharmacy, that's fine. The lab will make other arrangements, but it could be a new revenue stream for the pharmacy to start carrying some of those STD medications as well. So bare minimum, get set up with the testing side of it, because that's just basically mailbox money for you. The patient scans the QR code and the lab sends you a check. On low-hanging fruit here too, on the billing side for for flu shots. I just wanted to give this example. So I've got one client that did almost 10,000 flu shots last year. They were billing, like normal pharmacies bill and getting treated like normal pharmacies get treated. A redheaded stepchild, getting about $17 to $23 reimbursement per flu shot from the payers. We're credentialing this pharmacy now to be credentialed in the health networks for these payers. And so you can see that their reimbursement of $167,000 last year will actually turn into $1.1 million this coming year if they only do the same amount of flu shots. So it's about a 10x reimbursement billing on the medical side rather than the pharmacy side. So one of the programs that we offer and help pharmacies get credentialed to take advantage of. Definitely want to do that. Every telehealth, or every health hub, starts with the intake, the telehealth visit with the patient. You can even do get the vitals. Patients love this because it's high tech and really cool. Right through the camera, right there. We actually are capturing their, blood pressure, the breathing, all of that just through the camera. Really cool kind of James Bond technology there. So I'm going to show you this short little video here about personalized medicine.
One size evidently does not fit all patients. The pharmaceutical industry has produced Western medications, but it's remained unremarkable at the patient or the individual patient level, with only an estimated 30 to 50% of patients fully responding to many of the leading conventional drugs. Some treatments just don't work for some patients. Did you know that 99% of the population has at least one variant in their DNA that doesn't allow them to metabolize certain medications? The way patients respond to treatments is heavily affected by their individual genetic makeup, variables, and complex biology. We now have the science to personalize treatments. For more information, please join the Facebook group Healthcare.
So this gets into pharmacogenomics. This is something that's also a part of the health hub services, and the pricing on DNA tests is coming down. We're working with several different labs trying to find the very best program for our community pharmacies. Right now, we have a lab up in Michigan that we are referring pharmacies to because they'll pay you a collection fee. So it's just a non-invasive cheek swab, and you get reimbursed, $40 for that swab. And then the patient consult, the lab will pay $67 per hour for that consult. So if you sit down and do the interpretation with the patient, there's an opportunity there. The results come back very easy to read and to cover with the patient. It's kind of the stoplight approach. Green medications that work with that patient's DNA, metabolized correctly. Yellow would be the ones proceed with caution, and then the red are the medications that the patient should not be taking. So even though these health hubs are being set up at community pharmacies, quite often the recommendation is to deprescribe medications that are doing more harm than good, so we can see the drug-drug interactions better and more clear through these programs. More to come on additional services. There's only a couple, like Medicare will cover these tests if the patient is on 3 or more medications. One of the medications has to be either a heart med or a psych med, but their insurance is covering some of these tests. But we're working with another lab who might even bring the cost down for comprehensive tests down below even $100. So we'll bring more information to you as we have it there. But starts with, like I said, pharmacogenomics. There's other technologies that are being brought in to help also in the clinical setting. I'm not sure if you're all familiar with this 3S bioscanner yet, but this is a really cool cash program for our community pharmacies. This scanner actually tells patients what their antioxidant levels are. So it gives the patient a score of how healthy they are, right? The more antioxidants that a patient has, the better off their health is. The lower the score is, the more susceptible they are to diseases. And so this kind of blows the programs that you see from like McKesson and those out of the water, because you can actually have something tangible there to show the patient where their score is at. It's test therapy tests. So show you this slide real quick. It's like anything else, right? If you take somebody's blood pressure, they have high blood pressure, you put them on a blood pressure medication, and then you bring them back in 6 to 8 weeks to see the retesting. Same thing with any kind of medication. Somebody's deficient in vitamin B, then you give them vitamin B and then bring them back in and retest. So this is exactly what this scanner is doing, but for health and nutrition. You do the scan, you simply just put the patient's palm on there. Uses the same technology that has a Nobel prize for the blood tox or getting your blood oxygen level by just putting the little finger clip on, and it uses that red light that gets your blood oxygen. This uses a blue light, I believe, and right there on the fatty part of your palm, it can actually get a score of your antioxidant levels. So again, it's tests, you put them on a therapy. So this helps to improve your pharmacies. You can go into either your A1C programs, you can go into weight loss programs with this. You can just improve their antioxidants by offering your nutritional line of products that you have, and then you bring them back in to retest in 6 to 8 weeks. Put up a spreadsheet here that shows you just off of pretty conservative testing, because most pharmacies would charge $20-$25 per test, and all cash pay for the patient. And so if you were only doing 5 tests a day, you can see that in the first year, that can generate over $70,000 to the pharmacy. And then plus you have all the nutritional cells on top of that. Also wanted to share with you the blood analytics through Lab Smarts. This is all part of the wellness program, because these blood tests, so you're not having to take blood at the pharmacy, but when the patient brings in their labs, you can feed it into this software. And the software uses artificial intelligence to look at the blood markers. If there's deficiencies there, you'll know about those, and you can make recommendations to improve those deficiencies. This will literally tell us where a patient is heading into a disease state before it happens. So it's predicting based on all of the data and the results that come back. Basically, what happens is somebody gets their labs back, and the doctor says, "Yep, everything's normal." But what does normal mean from one patient to the next? And so this really dives into where the potential problems could be with this individual patient, and so you can really have a conversation about preventative health at that point in time. Okay, I want to show you a quick demo here of a new technology that has just received FDA Class 2 NGX approval, even though the technology has been around for 20 years. The FDA just only a year ago finally approved it, so that we can now do billing for insurance. Prior to that, only the rich and famous could really own the technology, because it was kind of expensive. And so a lot of pro athletes started to use this technology for recovery. So it helps with muscle strengthening, endurance. It actually has been proven to heal microfractures. So a lot of football players picked up on this technology. So when they're slamming into each other, they're getting these little tiny fractures, and this technology heals those fractures. We're starting to use this a lot in physical medicine with musculoskeletal. But I first came across the technology about 5 years ago. My niece had gone through radiation and chemotherapy for a brain tumor. She was completely healed of the cancer. They got rid of the cancer, but she had taken so much radiation that her little body couldn't, take any more radiation, and it just caused a lot of scar tissue. So it was hard for her to breathe. And there was a doctor up here in Scottsdale, Arizona, that he and a PhD had developed their own PEMF, pulsating electromagnetic energy program, that opened up her lungs and allowed her to breathe without the aid of oxygen. She called it her magic box. So that was my first introduction to a non-FDA approved medical device. Then fast forward, 5 years, and came across this device, medical device that's German engineered, so it's out of Germany, Swiss design. Let me bring up a picture here real quick, and so I can show you before stimulation. Let me show you there we go. So here is a blown up leg muscle. It's so magnified that you can actually see one arterial. So that's what's on the far left side is an arterial. That's one little individual capillary shooting off from the left. And then on the right-hand side is the venules. So this is the blood returning back to the heart and lungs. So this is before stimulation. You'll see how lethargic that blood is trying to get into that little capillary. But only after 3 minutes of stimulation, it's flowing naturally into that capillary. And after 6 minutes of stimulation, it's like the Autobahn just flooding into that capillary. You also see more activity with the white blood cells on the far right. And it lasts with patients. This is 30 minutes after a session. So it still, lasts up to 18 hours. This is me doing a treatment on Slick Willie. So there's Will Shaw there, who you heard from earlier. So want to show you this. He broke his ankle over playing about 3 years ago, but I guess a little longer than that now. 5 years ago, maybe, but over in France, he broke this ankle, and he's always had just some scar tissue and range of motion issues there. So we're doing a treatment to break down that scar tissue. This is the medical device here. This is the brains of the box. It has 2 ports on it. One port is going to the med bed. So the patient lays on this pad. So imagine like a high-end yoga mat with coils through it. Most patients' heads would be about where Will's shoulders are. He just happens to be really tall. So it's a full body experience, opening up the vasomotion, getting more oxygen and nutrients to the patients at the cellular level, and taking the metabolic waste out. And then this other treatment is spot treatment right there on his ankle. So an amazing technology. Like I said, the pro athletes and Olympic athletes were the only ones that really had that for a long time. But now with the FDA approval, we can make it available to any patient and do sessions with them. So an independent study was done, and they took a bunch of PEMF devices, and they put patients on it and measured their oxygen utilization, or the oxygen uptake and vasomotion, in day 1, day 2, day 3. You can see that the BEMER device, the one that has the FDA approval, just outshined all of the other devices on the market. And then they took all the patients off on day 4, so that you can see that the benefit drops to 0 with all the other PEMFs, but this BEMER device it's, it dropped only as low as it was higher than where the next best PEMF was. So that's one of the reasons why they got the FDA approval. But this is going to be big business in the future. You can see big tech and big pharma, GlaxoSmithKline and Google partnering up to develop a whole bunch more bioelectronics. The other program that we recommend is, again, focusing on musculoskeletal. This is for remote patient monitoring. And so basically, when somebody is recovering from, an injury, or they're trying to get range of motion back because of stiffness and soreness or what have you, this is a program that could be set up with the patient. And it's like when you go to the physical therapist and they work you out, it's almost like a torture. And then they hand you a couple of pieces of paper with the exercises they want you to do at home. Okay, so it's just diagrams of these exercises. You know that only about 30% of patients actually attempt to do those exercises. And out of those 30%, probably only 3 to 5% actually do them correctly. So this program, again, using the camera on a smart device, not only shows them how to do the exercise, but it tells them if they're doing it correctly. So if, for example, if you're supposed to do a deep squat and the patient is only going 75%, it's going to tell them you're only at 75%. You got to go deeper. Okay, now you're at 90. Okay, now you're at 100%. Come back up. And then it also tracks from 1 week to the next, so you can show the progress that's being made. So remote patient monitoring, it represents about a $2,500 to $5,000 reimbursement per program back to the pharmacy when this is set up with the CPT codes and everything we're billing. Again, needing to be credentialed to be in the health networks to do this, but we can help you get that done. So here's the all-inclusive program, everything that's been talked about. Anything can be added. Any one thing can be a la carte added and tested at your pharmacy to start bringing in additional revenue. But there is also a full all-inclusive program that covers everything that's a plug and play. So if you have room, if you have an MTM room, if you have a clinical room, you can plug the entire, FOI program. FOI stands for Fountain of Youth. You can't trademark the Fountain of Youth, and so they use the acronym FOI. But you can do a complete plug and play, and it's generating for the pharmacies that have set this up, they're generating anywhere between $20,000 to $35,000 a month in new revenue. There is an investment, and so we've lined up grain funding to get all of our pharmacy partners a zero interest line of credit. It's a revolving credit line, so once you pay it off, it's still there available to you for any additional needs that you may have, any other programs you bring in, or any expansion. If you've got to get into a new building, you've outgrown your space, then grain funding can help with that. Based on your company's credit score, you'll get up to 15 to 18 months of no interest. So you're just paying simply the principal. So the ROI on this program is about 2 or 3 months. Once it's set up, you've paid off whatever your investment was to get it set up in about a couple of months based on the new revenue that's generated. Want to get into now some of the exciting new products that we brought to the table and to help help pharmacies help their patients. And this is one of the most exciting ones that we've seen in a really long time. I've asked Scott Lanphier with Next Level Products to be here and explain the science behind this pathogen killing product. It will just physically kill any pathogen. I love this stuff. Use it anytime that I go out in public because I know I've got 4 hours of protection just with one squirt of this stuff. But Scott, why don't you tell us more about Zitracil?
Sure. Well, I appreciate the platform. Everything that Breck talks about is really trying to be focused on the community pharmacies, and it's I've never been around somebody that just wants to do service for other people, and it's always a benefit to on their end to people that I talk with, whether it's Willie or Jessica or anybody in the company. They're terrific. They're great service oriented people. Excuse my voice. I've been talking too much lately. What we have in our MyShield products is FDA approved and EPA registered products that are all water-based. And the two disinfectants that we have are water-based and on the N list and G list. And so everything is above board, transparent. I can provide all kinds of studies or anything, but the practicality is, like Breck said, is I can take a hand sanitizer product that we're all used to, the alcohol base, which lasts about 20 or 30 seconds. Once it dries, there's no residual effects, except leaving your hands red and chapped, and you're searching for lotion to heal them up. So what we have is water-based products that'll work up to 4 hours. Now, the FDA makes me say that, but if you look at the studies, like the one at the U of A in Tucson, after 4 hours, they could find no traces of the virus on the hands. So the problem is with skin is that we have skin cell slough. So the minimum you should get out of it is 4 hours. There's a good possibility you'll get a lot more out of it, and it won't wash off with soap and water. So you're going to get full benefit out of that. And Breck can attest to the wipes, the sanitizing wipes. You can rub it any part of your body. I just tell people you can rub it anywhere, just don't eat it. Other than that, you're safe with it, and that'll get you the same 4 hours. And so, like with especially little kids, you put the wipes on them, and then wipe up the play area that they're going to have, and the play area will be free of virus and bacteria for 4+ hours. We're having some success with talking to law enforcement because the wipes also remove fentanyl from most any kind of surface. So you can imagine how interested they are in that, because they don't know when they're going to come in contact with stuff. So if they can wipe stuff down, they're happy as can be. But for the pharmacy, you know, there's still 200 people a day on average dying of COVID in the United States today. It is not gone. Everybody acts like it's gone. It's not gone. 200, that's about 70 to 75,000 people a year still dying of COVID. And then we're going to get a new variant coming probably in the fall. I cannot stress this enough. We need to find the right kind of protectant because what we have doesn't work and it's bad for us. And so we want to get chemicals out of it. And the thing that's really great about what we do is that we create a barrier. So when the pathogen comes in contact with our barrier, that we get such quick cell destruction, it can't communicate to its chain back to the colony. So you get no mutations. So over time, we're not creating superbugs. It's like, you know, when I was a kid, mom killed everything with bleach, right? Well, now there's several bacteria that are resistant to bleach. Not that you won't kill it when you overwhelm it, but they're much more resistant to bleach. That's such a caustic, you know, but everybody's familiar with bleach. So the other problem is with existing chemicals is that once it dries, and I don't care what you use, whether it's bleach or anything else that you use to kill things with, once that product dries, there is no residual benefit. Our antimicrobial spray will last 30 days or more, killing germs without reapplication. I have many tests and field tests that show this. We're just trying to get the word out on how fantastic these products are. And many of Breck's staff has experience with it. And he didn't have to spend an extra week in Mexico because of the stuff that we did, unlike his partners. So we also can do this for wholesalers. If you want to market these products in the pharmacy, the markup is pretty generous. So it's not really about making a ton of money, but giving people an option to say, hey, I have some water-based products, not chemical-based products that range from wound care to again, hand sanitizer and soap, and I have just several things that can benefit your patients and people who frequent the pharmacy.
For our compounding pharmacies, his surface cleaner, because it doesn't have skin cells and doesn't slough off on surfaces, it lasts up to 90 days, right?
Well, that's what the studies say, but the EPA makes me stay at 4 weeks.
Okay,
But
4 weeks.
I can show you studies that it lasts way past that.
Yeah, really cool technology. My son calls it the little tiny swords. So it's basically these carbon shards that are 30,000 times smaller than a human hair. These little tiny swords actually pierce the cell of the pathogen, and then it burns up. Really cool technology. So thank you, Scott. Appreciate that. For more information, his information is up in the chat on that, but you should be carrying that product along with this product. Most of you are familiar with this and should be able to get it through your wholesaler. When we first started introducing this, it wasn't even in the wholesalers yet, but now you can just get it through McKesson, Cardinal, and AmerisourceBergen, or even your secondary wholesalers. But BioLite, amazing product. Anytime I feel a migraine or a headache coming on, I just drink a BioLite, and it's amazing how much electrolytes, the proper amount of electrolytes and hydration can do to knock out a headache. But 550% more electrolytes than the leading sports drink. So that's another market that you can market to, is not just patients, but also to sports teams in your town, in your area. Should be using this. A lot less sugar. They use monk fruit as a sweetener, so you're not getting all of the sugars and nasty artificial sweeteners that you get from the leading sports drinks. I have BioLite send out samples to anytime that I come across somebody that has a family member that's struggling with going through chemotherapy. BioLite will send out samples to them. It's an amazing product. That's why it was invented. This doctor here, his wife was going through chemo treatments, and the only thing that made her feel like actually getting out of bed was an IV, intravenous IV, and that wasn't practical to take her into the hospital every day to get an IV, and so he developed this drinkable, which it has everything that you would get in an intravenous IV, but you drink it. So the only difference is it takes now 15-20 minutes to go through your kidneys first before you get the same effect that you would get with the stick in the arm. But also they're now coming out with the powder, so you can mix it with the bottled water too, so it'll be a lot lighter for shipping and keeping in place. Let me tell you about this real quick, because the manufacturer here will actually send you a couple of free samples. So they'll send you $200 worth of product here that you can retail to your patients. It's an all-natural way to eliminate a couple of medications that may have some side effects for patients with dry eye, and this is just using the natural oils in your eye. And then Cindy, want to turn some time over to Cindy Gordon with Gordon Health Group to talk about her program.
Absolutely. Thank you so much, Rick. I love these calls because I learned so much. So my name is Cindy Gordon, Gordon Health Group. I work with small businesses to provide them with alternatives to traditional health insurance that ends up saving them between 25 to 35% on their premiums, but gives people back control over their healthcare decisions. We are uninformed when it comes to the medical costs of all of our medical services. It's the only products that we buy that we're not aware of the costs. The unique options that I offer empower people to be informed consumers, keep the cost down. There's so many ways for us to keep our medical costs down and not being taken advantage of by the big insurance companies. So I love to educate small businesses because healthcare Health insurance is so important. As business owners, we need to stay healthy. We need our staff to stay healthy. And we want to encourage them to be proactive around their health. And the products that I have do just that. So thank you for the opportunity to allow me to introduce myself, Breck. I truly appreciate you.
Yep, you're welcome. And Cindy's contact information is up in the chat. If anyone has any needs or needs help reviewing even your current health program that you offer for your employees. And next, I think most everyone is aware of the Pharmacy Profit Summit that's held each August in Dallas, Texas. So Dr. Lisa Foss puts this on, covers a lot of the same things that I talk about. In fact, one of the speakers this year is our credentialing and billing expert, Candy Morris. So you'll get to hear from Candy at that conference, or you can get to hear from her a lot sooner, right directly from me and her when we sit down together and go through your credentialing needs. That is the program. Like I said, wanted to get you out of here in under an hour, but certainly would open it up to questions. My contact information is also up in the chat, and you'll see my Calendly link. That's the link that's being shown right here on the screen. That's the easiest way to schedule a one-on-one if you're ready to start talking about what the potential is for credentialing your pharmacy to get those better reimbursements. If you need to speak with Will about getting set up for third-party claims billing, that's the easiest way, is just go to that Calendly link and get schedule some time on the calendar. But love to open it up to any questions you might have for me, for Cindy, for Scott, for Will, anyone that's presented today. The floor is yours. Please speak up. And if we don't have any questions, please save the chat so that you have everyone's contact information. Just simply to save the chat, just simply click on the chat. You'll see on the at the very bottom of the chat, you'll see some icons. You'll see 3 little dots. Programmers are weird, so those are called meatballs. They think about everything as food, I think. If you see the 3 lines anytime that you can click on when there's those three lines, that's a hamburger. But these are the meatballs. So, Damar, you have a question?
Yes, I do. So you and I talked a little bit about, I can't think of the word right now, but essentially ServRx. As far as for prescriptions, is that I wasn't sure if that was available in California or not.
Yeah, good question. And so because we are now, we do work with pharmacies in all 50 states. We have patients in all 50 states and even Puerto Rico and Guam as well, U.S. controlled territories. But we are 100% out of network. And so we don't work real well in certain states like California, where you have to be in the NPN, their little closed networks. But we do process claims there for patients, but it's not a good fit for our program being 100% out of network. Other states that we have issues with would be, Jake's state. He's in Ohio. They have the Ohio Bureau of Workers' Comp up there, so they have a monopoly. Everything has to go through the Ohio Bureau. Washington State, and we had somebody here, Wade, or somebody from Oregon also, that they have really strong state funds up there. And so there's like Washington Labor and Industry or Washington L&I, and then Oregon has their state fund as well. So there are some monopolies in certain pocket areas, but because we work with pharmacies in all 50 states, we do process claims. It's just not a focus of ours in California.
Okay.
Now the wellness programs, because a lot of them are cash pay, or they're on the medical side, where we're credentialing the pharmacy with the with the on the medical side for services, then yes, we do work with California pharmacies in that standpoint. But for third-party billing for workers' comp, California pretty much has to go through the networks that the pharmacy belongs to.
And what's being done as far as helping when a pharmacy signs up for the services, for the wellness services? What is being done to market those services to their market?
Yeah,
whether
excellent.
That's local.
Excellent question. A social media campaign has already been launched nationally. There's well over 100,000 people that are following that campaign today. There's that Facebook group that I alluded to in that little short video for personalized medicine that has over 3,000 patients that participate in that group. And so I'm directing patients to pharmacies today through the social media efforts. But what's really interesting is when a pharmacy puts up a poster that they have the fountain of youth, patients want to know more. And when that patient experiences how they feel after experiencing some of the services of the fountain of youth, then they're going out and telling their family members and their neighbors. And so it's kind of, word of mouth has been a wonderful advertisement for us.
It's great.
Yeah, great questions. Any other questions? Well, I appreciate everybody being here today. So grateful for you taking time out of your busy schedules. Please save the chat, click on those three little meatballs, and you'll see at the top, save the chat, click on that. That'll put it into the Zoom chat folder, or after we close this meeting, it should just pop up so that you can, I like to open the chat and copy it to a Word document so that I can put it in a file folder where I know exactly where it's at, so I don't have to go looking around in Zoom for it. But yeah, save the chat, book some time with me if you're interested in any one of these services. If you have clinical space at your pharmacy, you should be taking advantage of these opportunities to generate more revenue. At a bare minimum, let's see what your vaccination program is and how we can improve those reimbursements on just giving a simple flu shot. So please schedule some time with me. I'd love to chat with you further and see how we can best help you. I appreciate everyone for being here again, and thanks to all of our presenters, Scott, Cindy, Will. Appreciate you being here and supporting this meeting, and look forward to hearing from you. Thanks, everyone. Have a great rest of your week.